Next, I would invite Dr. Abdul Ghafur, please.
Good afternoon. In science, we doubt, and in religion, we trust. Whether it is modern medicine, you call it as allopathy, homeopathy, or Ayurveda. If you believe the knowledge in our branch of medicine is absolute, perfect, final, then we are practicing religion and not science. It's applicable to all branches of medicine or all branches of science. Because in science, we need to keep on doubting, keep on questioning, skepticism. That will lead to inquiry, that will lead to research, that will lead to evidence. What we need is evidence, and we are all practicing science. We cannot practice science without evidence. I practice infectious diseases, and my area of interest is infections in cancer patients. All my patients are cancer patients. The most immunocompromised population you can ever come across. 99% of the cancer patients die because of, not cancer, they die because of infection. That's the cause of death. If you look at the death summary of cancer patients, there'll be one word, sepsis. And we are living in an era where there are no effective antibiotic to treat severe infections. And that's called as antimicrobial resistance. It's a serious challenge. I have treated plenty of patients. My colleagues across the world have treated plenty of patients where there is not even a single antibiotic effective to treat some of the infections. I had a patient last year, I had several patients, just for example, a 25-year-old boy with lymphoma, his lymph nodes are the size of a football. When he came to us for chemotherapy a year ago, he had very bad sternal osteomyelitis because of drug-resistant Pseudomonas. Sensitive only to two antibiotics, colistin and amikacin. The problem is, none of these antibiotics penetrate the bone. They are good for blood infection, but he had a bad sternal osteomyelitis. Pus was pouring out, and if the oncologist gives chemotherapy, he's dead within few days. That Pseudomonas will enter the blood, he will be dead. I can't give chemo clearance. An oncologist cannot give chemo without my clearance. I gave colistin, amikacin, and both are nephrotoxic. Creatinine goes up within few days. Somehow the pus discharge reduced. We gave first chemotherapy. He somehow survived. None of us thought he will ever come out of the first episode of chemo. But somehow I gave repeated courses of antibiotic again and again. Somehow pus always pouring out. Never stopped pouring out. We gave multiple courses of chemo. He somehow survived. And 2 months ago, he came with full-blown osteomyelitis. There is no bone in his chest that is not infected. Pus was pouring out. Thoracic surgeon resected a lot of bones. And luckily, we had an Indian antibiotic called cefepimcedobactam undergoing international phase 3. With a DCGI permission, compassionate usage, I gave that antibiotic, and 6 weeks, his infection is cleared, and we gave chemotherapy again, and he's walking around. But that is the power of science, but the limit of medicine. I work in a cancer center. Every day, I hold hands of the patients who are dying. There's not every day that I don't see death. Despite all the wonders of medicine, all the wonders of science, we do have limits in science. And antimicrobial resistance teaches you there is further limit in science. And that's the reason why I also run a trust called AMR Declaration Trust, because AMR is my passion. I've been working in the field for 15 years. Every health minister, every health secretary, every drug controller general will get my email almost every week for the last 15 years. I run a trust called AMR Declaration Trust. Recently, we brought out a booklet called as No Option, where 17 infectious disease doctors in the country has written what exactly we mean by no option, scenarios where not even a single antibiotic is effective. And we gave 17 solutions by scientists from across the world, including new antibiotic, new vaccines, new diagnostics. And I asked Dr. Kusum Chand, who's, he's a homeopath, he's an MD medicine, MD homeopath in Delhi. She wrote a chapter on how she treats infections with homeopathic medicine. My practice in oncology, my interest in AMR makes me open my eyes, and I am very open to ideas from any branch of medicine, any branch of science. But what you need is research. I understand through my Dangayaji is like my elder brother. I communicate with almost every day or last several years. And I know many homeopaths through Dangayaji, and my patients give me stories of several success stories of homeopathy treatment. I'm open, several people are, we are all open, but what we need to do is research. And I also understand you're doing a lot of research, but we don't know that. It's not in the media, it's not in the discussion. You need to do more research, and you need to talk about it, discuss about it in open forum, not in your forum. That's why you convince people. That's why you attract more. That's how you do more research. And that's how you succeed. You have the ability, you need to show that in a big way. Thank you.